Welcome to the Health Wealth Podcast and Radio Show with Forbes author and contributor Dr. Josh Luke, America's Healthcare Affordability Authority. Visit drjoshluke.com for information on speaking appearances and other resources.
Hey guys, it's Dr. Josh Luke here with my first ever Health Wealth Podcast. I'm so excited to host this podcast, that you all can join me. It's been a big production to order this big step and repeat banner, to order all this equipment, cameras, microphones, headphones, get it all coordinated. But I'm really excited to bring it to you because my goal and my mission is to be America's Healthcare Affordability Authority. And I'm really excited to be that person. I'm really thrilled that Forbes recruited me and asked me to be the person that they thought could best help American businesses find a way to stop the annual 15% increase for health insurance from their broker. Interesting, 15% increase, but less services every year. Anybody notice that? So it's about time we declared the tipping point and said enough is enough, and we're no longer going to pay these increases for less service, and that American businesses found ways to improve the level of coverage for their employees and drastically reduce the amount they're spending, because healthcare is, quite frankly, bankrupting American businesses. It's bankrupting American families too. But we're going to start with businesses, and one of the first things I wanted to cover is that you can now find all things about healthcare affordability in America at my new website, health-wealth.com. health-wealth.com. That's where you'll find Dr. Josh Luke, America's Healthcare Affordability Authority. On that website, you're going to find a number of things. You're going to find where you can order my book from Forbes Books, Health Wealth, Is Healthcare Bankrupting Your Business? 9 Steps to Financial Recovery. If you're interested, you can also find the 9 interactive steps to financial recovery. They're the same 9 steps in the book, but we'll spend about 20 to 35 minutes on each step, really articulating it and talking about why it's important, how it fits in, why it might be a good fit for you all. On that website, there's also a free assessment. It's called the Health Wealth Loss Assessment. Remember, anytime we talk health wealth, it's health-wealth. The Health-Wealth Loss Assessment is free for all employers. And what it does is it helps you identify a couple things. Number one, how much money you might potentially be leaving on the table by overspending on healthcare services, basic healthcare services, year over year. And number two, which of these 9 steps or additional steps might be most appropriate for your company once you declare the tipping point. Now remember, it's up to you to declare the tipping point. I always joke, it's so funny when I talk to people about, hey, tell me about health wealth, what is it? And I explain to them, hey, most American businesses, healthcare is their second largest expense. Number 2, behind payroll, okay? And when you ask them, when are you going to declare the tipping point? They say, oh, we've already passed the tipping point. Now I kind of joke and say, hey, the definition of a tipping point is that you change your behavior. And since you're still paying that 15% annual increase, you really haven't declared a tipping point. When are you going to? And that really hits home, particularly when it's the individual who's responsible, whether the director of HR, the director of financial services within a company, who's responsible for healthcare spending. So that's what we're going to talk about today. You have the book, you have the 9 interactive steps to financial recovery, you have the Health Wealth Loss Assessment, which is free to any individual or company that wants to come and see if A, they're leaving money on the table, and B, which of these 9 steps or others might be most appropriate for them. Also, if you're interested in me coming to speak, which is what I love to do, and I love to entertain audiences. People say, gosh, Josh, your stories are great, you're funny, but most importantly, you give me these tips that are really practical and simple, both for my business and for my family, to make healthcare much more affordable. And guess what? You're also improving my access to care, better doctors, better access to hospitals, understanding how to save money, understanding that some disease-specific programs might be most appropriate for me. And of course, the 3 P's to healthcare affordability. Have a plan, and that plan is going to be based around preventative medicine and personalized medicine. So it's really exciting to share these things with you. And at health-wealth.com, you're going to find each of these things. The other website I have is drjoshluke.com. drjoshluke.com is my speaking website. It really tells you where I've spoken, how to access me to schedule speaking, get you to my scheduler and my speaking agent. I'm excited about that as well. If you're interested in some healthcare affordability consulting, that would also be on health-wealth.com. Remember, Dr. Josh Luke is only for speaking appearances, things like that. It's a fun website. Check it out, drjoshluke.com. But to finish up on the consulting part, so you'll see at health-wealth.com there is Health Wealth Partners. And what that means is if you wanted to hire me to consult, I do that, but it's more so about me coming with the loss assessment, helping you understand where your opportunities lie, what the opportunity for savings is, which of course everybody wants to hear about. But also, once I've seen that loss assessment and spoken to you, I send in colleagues who I think are best suited for your company, your community, your organization, your employees, based on that loss assessment. Because remember, all 9 of those steps aren't going to make sense for you. I send in a few of those colleagues I have that I think are good fits for your organization, and you start to put together your plan, your road to financial recovery, your health wealth recovery plan to reduce your spending by up to 30%. And guess what? It's also going to improve employees' health care and improve morale as well. A couple other things I wanted to share with you is I regularly contribute on Forbes as a blogger and as a writer. And I also have daily features, daily video minutes on LinkedIn. So if you don't follow me on LinkedIn, please do at drjoshluke.com. This is the first episode of my podcast. This podcast is and was created to help Americans find more affordable solutions for healthcare, to drive down your business's spending on healthcare, to drive down your family's spending on healthcare, and just to kind of recap the calendar of what you can expect from me and my commitment to Health Wealth is in January of 2018, the release from Forbes books of healthwealth.com, Health Wealth is Healthcare Bankrupting Your Business, 9 Steps to Financial Recovery. 6 months later, in September of 2018, the release of Health Wealth is Healthcare Bankrupting Your Family, 5 Steps to Save $5,000 a Year, or something along those lines. It's still a tentative name, but I'm really excited about that. And another recent development that I want you to be aware of, if you haven't checked out the Masters of LinkedIn Summit, May 2018 in Los Angeles, I'm grateful to be one of the keynote speakers. It's going to be a great event. If you are fortunate enough to be in the area, check it out. But thanks again for joining my first podcast. If you're interested in learning more about healthcare affordability and ways to reduce spending for your company and for your family or you as an individual, that's why we're here. It's the Health Wealth Podcast with Dr. Josh Luke. We'll see you next time.
Thanks for tuning in to this episode of the Health Wealth Podcast and Radio Show with Forbes author and contributor Dr. Josh Luke, America's Healthcare Affordability Authority. Visit drjoshluke.com for information on speaking appearances and other resources.